Hi. Okay, first I just want to say congratulations because if we're talking about food reintroduction, that means that you have made it through your 23 days of the elimination diet or you will be getting there close. So, when we talk about food reintroduction, we're going to be picking foods initially that you miss the most. They are the things that we want to see if we can add back, because obviously if we can add back in a food that you really enjoy, that makes you full, keeps you satisfied, they are the foods that we're going to focus our time and attention on initially. Okay, so what we want to focus on is reintroducing a food, and then you are going to wait about 2 to 3 days before you add in another food. And you do want to eat a generous amount of this food. So if you only have one bite, it may not be enough to stimulate a reaction in the body. So you're looking for about 2 to 3 average sized portions on the day that you're adding in a new food. And you will continue to eat your regular foods that you've been eating on the elimination diet. So this will only be one new food. I will give you a food reintroduction tracker sheet that will be uploaded to your Get Healthy account if it hasn't already. So you will be able to easily track your new food with your symptoms. After you add in the food, typically it's a 2-day window. Sometimes I like to wait 3. We will discuss that. That is all patient dependent. So not every person will be quick with the 2-day. It also depends on the food as well. So we may go to the 2 to 3 day window. You're going to watch for any symptoms at all. If the food produces any symptoms, you're going to stop eating that food immediately. And then we will have to wait a few days until you feel back to normal or as good as you did before we put that food in. You're going to begin testing. Typically, patients want coffee or tea or chocolate. We will try those foods. Again, whatever food you were missing most, we are going to try first. Now, these are the top foods to add in. I personally am not a proponent of wheat. Wheat has been, unfortunately, just compromised with Roundup, the herbicide, and it is very difficult to find a clean wheat product. But for reintroduction purposes, just to know whether or not you are reactive to wheat, I do have it listed on here. So it's not something that I say you should keep in your diet regularly at all, but we will reintroduce it to see if you have a reaction. Because if you do have a reaction and it is severe, then maybe that is something that you avoid from here on out. But if you do not have a reaction, then on a birthday or on a special occasion, if you go out and you eat pizza or you have cake or, whatever it may be, you know that it's not having a significant negative effect on you. If these foods stimulate a reaction, then you may, again, have to just eliminate them long term. Dairy is listed on here: corn, pork, eggs, peanuts, soy, shellfish, barley, and rye. These are all your kind of top allergens. Now, we do want to be very specific with when we're reintroducing the food. So don't eat a chocolate brownie, right? Because now we don't know, was it the chocolate, was it the dairy, or was it the wheat? So we want to be very specific and try to just pick the one singular food to add in. Symptoms can be wide-ranging. So most people think of just GI upset, and they are some of the most common. So you're looking for belching, bloating, diarrhea, constipation, gas. But they also can affect your mood. I have patients, they eat wheat and they just get depressed or have really bad anxiety. Headaches are another one that's big. Having issues with your sleep. Maybe you can't fall asleep or maybe you wake up. That is very common. A lot with sugar. I noticed that can be something that interferes with patients' sleep. So it could be itching, skin rashes. Maybe your face gets red. Maybe immediately after you eat it, your nose starts running. For me, I don't drink alcohol, but when I did, I would drink a regular beer, and before I was halfway through one beer, I was congested and my nose was running. So I, know that I do not do well with wheat and barley and those things. So I just stay away from them as a lifestyle. But that is something that can happen immediately. And sometimes it happens to patients and they don't even realize it was from the food. So we just want to kind of list out some of the most common things. And again, I will be helping you through this process. So we'll be able to identify the food and the reaction very easily together. This is the sheet that will be uploaded to your Get Healthy. Very easy, day 1, day 2, day 3. I will give you more sheets as you need, and then you have the food that you introduced, and then any symptoms that popped up. It's a very easy tracking system. Now, if you do eat something and you get a reaction, it is recommended that you take the food out, again, for another 3 to 6 months. Take it out for a longer stretch of time, have your body down-regulate again from any issue that had been caused. Now we're really letting the body heal and go without that food. During this 3 to 6 month time, more than likely I'll give you some specific supplements to help support and heal the body. They'll be targeted towards your GI tract to help calm that area, decrease any histamines, just help the body heal before we try to reintroduce the food again. Occasionally, a food allergy test may be recommended to help identify if it is a true allergy. It also can help identify other reactive foods. That will not be with most patients, but that could be a possibility. So remember, we're just going to go slow and steady, and we're going to start with those foods that you miss most. But reintroduction phase is usually pretty easy, pretty short, and hopefully we can get you eating some different foods.